You're welcome to the Gavel. I'm Linda Akibi. The National Assembly is on recess in response to the coronavirus pandemic, which has gripped the world. And this is as the Federal Capital Territory is on lockdown to prevent the spread of the virus. But the leadership of the National Assembly has been meeting with major government agencies managing the COVID-19 pandemic. For 3 days, the federal lawmakers met with heads of different government agencies to get more details of the federal government's actions to manage the pandemic, as well as intervention initiatives to reduce the impact, particularly on the poor and vulnerable members of the society.
For more than 5 hours, the leadership of the National Assembly took members of the COVID-19 Presidential Task Force up on the management of the pandemic. Senate President Ahmed Lawan set the tone for the interface, expressing concern over the management of the donations pouring in from private sector to address the pandemic. It's a sentiment shared by the Speaker of the House of Representatives. The Secretary to the Government of the Federation paints a bleak picture of the country's health sector.
I believe that we face one critical challenge today in our fight against COVID-19. We hear donations made by various organizations, corporate bodies, and so on and so forth. But it is my candid opinion that there is no coordination. The corporate world, I was told, as at yesterday, the corporate Nigeria, let me limit it to that, has gathered 22 billion naira. NNPC, I was told, had $28 million. CBN and the banks, I don't know how much they have. And in fact, National Assembly, the ministers, and so many individuals and institutions have also made donations. I believe that we must have a central body, and not PTF, neither the corporate groups that should receive and manage the funds based on what our Constitution provides for. Whatever monies have been raised by the corporate bodies, the banks, NNPC, and maybe the IOCs, should be in one central account. Should be in one central account. Where PTF has requests, such requests, of course, will also pass through us. We look at the requests and the funds based on endorsement. The funds can be utilized.
Whilst we are not casting aspersion on any personality, we will continue to do what we're supposed to do. The issue remains the same. Where is this register? How did you come about the register? Who are the beneficiaries? What is the geographical spread? We seek to improve the system. A laudable program by government, fantastic program. First of its kind in Nigeria. We seek to make it better. Those who come after us will also seek to make it better until we get to as best as we can. To now question that intention or the motivation behind it does not do the people of Nigeria any good. No matter what you feel about the National Assembly, we run a constitutional democracy that provides an essential ingredient called checks and balances. To suggest otherwise and to set a precedent that anyone or any institution, local or foreign, can stop the National Assembly from carrying out its constitutional responsibility as in sections 88 and 84 will be setting a dangerous precedent. What it means is that we can appropriate money and will not be able to follow the money. And we'll leave that money subject to the whims and caprices of anybody and whoever to do whatever they want with it. That is not accountability. That is not probity. That is not transparency. That is not what this government told Nigerians that they wanted to do. This National Assembly should develop a legislative framework to prepare Nigeria for any future pandemic. 2, develop a legislative framework for reforming and transforming our healthcare systems. I can tell you for sure, I never knew that our entire healthcare infrastructure was in the state in which it is until I was appointed to do this work. Our infrastructure, health infrastructure, is in the most deplorable state. If countries in Western Europe, America, can be overwhelmed by the COVID-19, my prayer is that we don't get to that stage. We do not have an infrastructure that can carry that burden. 3, strengthen the legislative framework for economic growth through domestic manufacturing. And 4, deepen the legislative oversight during this pandemic and beyond. Pass legislation, and 5, pass legislations that will further ease the ability of the executive to cushion the impact of the economic decline. And 6, be part of community mobilization and enlightenment efforts. You are the representatives of the people. If you go back home and speak to the people about the need to stay at home, about the need to maintain social distancing, about the need for personal hygiene, they are more inclined to listen to you than just the broadcast. So that responsibility squarely is for you, our leaders in the National Assembly, to mobilize the communities and ensure that they adhere to the advisories that come out of our health agencies and WHO.
The Speaker of the House of Representatives is curious about the hazard allowance for frontline medical personnel handling COVID-19 cases, but he is dissatisfied with the response from the Minister of Health.
The people on the front lines, the nurses and the first responders and all of those people, I guess there will be no point asking how much they are paid. But do they have a hardship allowance like you get in most other countries? Are you paying them a hardship allowance extra from whatever they may be earning? Because they're the first contact. They're in a very dangerous situation. They're putting their lives on the line. Are they getting paid a hardship allowance?
The first line of defense, as I said, are the port health officers who meet the people at the point of entry, whether it's an airport or a land border, and then do the screening and have to collect the questionnaire. We were among the first to issue questionnaires that give you a travel history.
No, are they being paid a hazard allowance?
They are civil servants, and the payment structure is not what I can speak of, but I'm also going to talk about the other frontline.
No, hold on.
They won't do the tracing.
Hold on.
They are also frontline.
Are they paid? I'm not talking about their civil service payments. Are they being paid a hazard allowance for the job that they are doing?
I am not aware of it.
You're not aware?
It's a standard job they do every day.
It's a standard job?
Yes, a standard job.
I thought you said coronavirus was novel. How is it now a standard job that they're doing?
Because screening is what you do every day.
They don't screen for coronavirus every day. They've never done it. They've never done it. This is the most infectious disease in the world.
They're screening for temperature. That's what they're
doing.
So
the answer to my question is that they're not being paid a hazard allowance.
No, the answer you're right on
that you don't know
is that I am not aware.
But you should be aware, though, as a Minister of Health. You should be aware. Quite honestly, you should be aware whether your guys are being paid a hazard allowance or not. It's not enough to say that you don't know. Quite honestly, you dropped the ball there.
With regards to that, I know that the Honorable Minister of Finance was here, and she spoke to this very meeting of the leadership about the insurance package that is being looked at to cover our frontliners in terms of those at the ports and also the people that will provide care. I believe that it is a comprehensive package that is being put together. We all appreciate the fact that this pandemic is thrown on us. Nobody was prepared for it. It's now that the preparations are being put in place to deal with it, but I can assure you that every aspect of the welfare of our doctors, our nurses, and people who will be in the points of contact with likely infected persons would all be covered in this comprehensive package that is being prepared. The content of it is what I cannot give details of. I would defer that after consultation with the Honorable Minister of Finance. We will come up with a package that would cover the entirety of the structure of those that are responding to likely people that are infected. So.
The Health Ministry goes on to give an overview of the isolation centers in the country and the status of the Chinese doctors who arrived the country on Wednesday, April 8.
We made it very clear to CCECC, under whose auspices these ladies and gentlemen came in, that these are the rules in the country, and they apply to everybody coming in. Even the flight crew that came along with them, that brought them here, that everybody is eligible to that 14-day. Okay.
The Speaker of the House of Representatives also asked the Minister of Health to provide the particulars and address of the 15 Chinese medical personnel who came into the country on Wednesday to the National Assembly for legislative oversight.
I'll ask the Chairman Committee on Health in the House to contact you, which I know you've been in touch with him. Can you please furnish him with the address where you have to oversight and make sure that these people are actually where they're supposed to be?
Yes, I have the address which I can give to you, and according to the agreement we have, they should grant NCDC access at any time. That was the agreement, to look at what they are doing, and also for NCDC to pre-inspect the premises. And that pre-inspection was done, and then they just came in yesterday at about 4:30 or 5, and that the NCDC will have access to look. That's where we agreed upon. I personally have not been in there, so I cannot give you details.
Thank you.
The COVID-19 Presidential Task Force wants the National Assembly to develop a legislative framework to prepare for any future pandemic, as well as develop a plan to reform the country's healthcare systems.